Well, a couple of the things that I think show some promise right now, and it is early, are the second generation ALK inhibitors. We have seen at this meeting that there have been significant responses in patients who had progressed on crizotinib. So that's interesting, and I think will help patients. Again, we have to keep in mind it's a small percentage of patients. The same thing is true for the combination of afatinib plus cetuximab. So we have the second generation EGFR inhibitor, a newer one, combined with an anti-EGFR monoclonal antibody, cetuximab, and those trials are showing encouraging survival, response rates, not survival. And so far, they appear to have acceptable toxicity, but I think we need to gain more experience with that combination. I actually think one of the things that we need to look at is the resistance to therapy that happens in all patients, whether they get chemo first or they get ALK inhibitor and EGFR inhibitor. And one of the things that we think might be an important part of that is this a concept of epithelial to mesenchymal transition, where the mesenchymal cells become more stem cell-like. And a lot of the preclinical stuff says these particular cells are resistant to everything: biologics, chemo, radiation. They don't do well with surgery. There are surgical series that suggest more mesenchymal tumors do worse. I think that's one of our challenges, and we need to either figure out how to come up with something that keeps them more epithelial and hopefully treatment sensitive, or something to target these stem cell-like populations of cells. That, to us, is one of the things that we think is going to possibly affect a lot of people. What is the common pathway? I mean, all these patients, unfortunately, eventually go down a pathway where you can't stop their disease. Is that kind of several common pathways, or is it multiple that we have to figure out what each of them are? But I'm guessing there are going to be some common pathways, and we have to figure out some new ways to treat those patients.